Hello everyone, welcome to another session of Pharmaceutics Recalls discussion. Let's start with question number 26. Which of the following properties are characteristic of flocculated particles in suspension? The options are particles form loose aggregates, rate of sedimentation is high, a sediment is formed rapidly, the sediment is loosely packed, all of the above. So here the correct answer is option E, that is all of the options are correct. That is all of these options are the properties which are the characteristics of flocculated particles in a suspension. The rate of sedimentation is high because particles settle as a flock. Flock means a collection of particles. Although a sediment is formed rapidly, it is loosely packed and possesses a scaffold-like structure. Because the particles do not bond tightly, caking does not occur. The suspension may not appear uniform due to rapid sedimentation. Question number 27. Surface active agents are included in some tablets too. The options are increase the bulk of the tablet, make the tablet easier to swallow, reduce the disintegration rate of the drug, improve the flow properties of the granules, increase the dissolution rate of the drug. So here the correct answer is option A, that is in order to increase the dissolution rate of the drug. So what are the surface active agents? They are molecules with the capacity to adsorb to solid surfaces and or fluid interfaces, a property that allows them to act as multifunctional ingredients. For example, wetting and dispersion agents, emulsifiers, foaming and anti-foaming agents, lubricants, etc. The surfactants are a category of chemical compounds that are used in lowering the surface tension or interfacial tension between different compounds such as two liquids or between a gas and a liquid, or it can also be between a liquid and a solid. Surfactants are categorized as organic compounds and are amphiphilic in nature. Amphiphilic means they contain both hydrophobic and hydrophilic groups. Next question. Masking the bitter taste of drugs may be accomplished by using which of the following tablet coatings? The options are enteric, film, sugar. So here the correct answer is option E, that is enteric, film and sugar. All these coatings can be used in order to mask the bitter taste of the drugs. Question number 29. Different crystalline forms known as polymorphs of the same drug exhibit different. The options are metabolism rates, melting points, solubilities. So here the correct answer is option D, that is melting points and solubilities. That is the different crystalline forms, that is the polymorphs of the same drug exhibit different melting points and solubilities. Polymorphs differ in their melting points, X-ray diffractions, infrared spectra and dissolution rates. Metabolic rates of a drug's polymorphs will not vary because once the drug has dissolved, the polymorphs no longer exist. Question number 30. Although isotonicity is desirable for almost all parenterals, it is particularly critical for. The options are intra-articular injections, intradermal injections, intramuscular injections, intravenous injections and subcutaneous injections. So here the correct answer is option E, that is subcutaneous injections. So an isotonic solution is the one with a salt concentration that is exactly equal to that of the blood cells. A subcutaneous injection will come into contact with a large number of nerve endings and may remain at the injection site for a long period of time. So pain will be experienced if the solution is not isotonic. Hence this isotonicity is particularly critical for subcutaneous injection. So with this question we have completed today's recalls discussion. Thank you for watching this video. Have a good day.